Okay, Dr. Huebner here, Natural Transplants. I'm here with my patient Bill. You may remember Bill from 2 days ago having his surgery. So he's here for follow-up, just kind of checking things out. And you know, everything looks amazing. He hasn't lost any grafts. Things are starting to clear up a little bit, although there's obviously still going to be scabs up there for a couple more days. But eventually this will all be smooth skin again, maybe have a little bit of redness to it like you got a sunburn, and then eventually that will fade. So looking at everything, I'll show you everything as far as the incision line and the top. But Bill, overall, how do you feel? How's the recovery been?
You know, I can't say enough about how painless this whole procedure was. You would think that there would be quite a bit of pain involved, but it really is just sort of an innocuous, it's better than going to the dentist. I've had worse issues at the dentist than with this. So I, so far, completely recommend this process.
I hate the dentist. We hear that a lot actually. That was it. It was like a day at the spa. You know, it was nothing. So, and in recovery, you know, a little bit of pain medication here and there, maybe the first night or two, but after that, you don't really need much at all. If you want to zoom in here, Josh can show you exactly what it kind of looks like here. So you can see that it still has, you know, you can see the grafts are still in place, but definitely have a couple scabs still left on here. Eventually, all those will go away. Again, you can see the staggered hairline in the front. So it's going to be up and down, up and down. These ones in the front are going to be tiny, tiny grafts, 1 and 2 hair grafts. These bigger grafts behind it are going to have 5, 6, 7 hairs in them. So with his thin hair type, that's going to add a tremendous amount of hair and a tremendous amount of density, more density than he would get if he went elsewhere and got, say, FUE, or got little tiny grafts where people were basically cutting his strip into as many tiny grafts as possible. While they might cover some area, we never get the density that he's going to achieve from one procedure here. I'm going to turn you around here, Bill. I'm going to show him the incision line in the back. So, first of all, as you can see, it's completely covered. So when he wears his baseball hat, no one knows that anything happened. So let me just show him the suture line. So the suture line looks nice and clean. And you can see, I just completely approximated. Nothing to worry about with that suture line. That looks great. So in 10 days, the sutures will come out. I'll have a tiny scar, which will continue to fade over the next year. All the way around. See how.
And even my hairdresser won't do it.
Exactly. His hairdresser probably won't even know what happens. Well, he's going to know something happened because you're going to have a bunch of hair. But he's going to be suspicious. You know, how do you take this hair piece off? How do you know? But you know, this is great. So, and the nice thing now is that if he ever wanted to have another procedure, for instance, to fill in the crown in the back, or even just to get more density in the front, you have untouched area above and below where we went that he could very easily get another strip or two. So that's the advantage of having a strip method with good result with a scar, as opposed to having the FUE process where he would basically be out of luck. Then we'd be going into areas that already have scar tissue in it, and the types of grafts that we need to get him density, you just can't achieve with FUE. So, Bill, I'm very excited to see your results. You want to show them what you look like with your hat on, man, just so we can show you that?
Well, sure. And that whole FUE issue is what really drove me to choose you, just because I didn't want to be in a situation where I didn't have the donor sites to adequately do what we need to do.
Yeah, so protect your donor. That's the message here. Just protect your donor. It's very valuable. You can get to where you want to be, but just don't screw it up in the back. So, but you can see as he wears his baseball hat, he looks like a normal guy.
About like that.
He doesn't act like a normal guy. So thank you so much again for letting us show you off here, and looking forward to seeing your results.